Thank you so much, everyone, for joining in. A very good morning to all to the Health of India, Uttar Pradesh and Uttarakhand E-Summit series. Thank you so much for joining in. Like all the webinars and the Zoom calls and the conferences that have been happening in the last 1.5 to 2 years, really strange and uncertain time, but this one too is going to be virtual. Sadly, actually, we would have loved to be there in person in Uttar Pradesh, in Uttarakhand, and I've had a cup of coffee and have made this discussion on one-on-one. I think there is just no substitute to that. But right now, I think we're helpless, and it's just we're helpless, but we're hopeful that I think we should meet very soon and the pandemic should get over and we will come and see each one of you in person. But till that, I think we will do the best we can with the virtual summits that we are doing. This edition of E-Series, Health of India E-Series, is focusing on health of Uttar Pradesh and Uttarakhand. But before we start this edition, I think we should take a moment and we share our sympathies with the families of those affected by the natural disaster over the last 1 week in the hilly state. We are sure the state will bounce back soon. All our prayers with the affected people. All of us have been witnessing the worst crisis of the century. I think a crisis that has taken away lives and livelihood. It has cost so much of money, in fact, taken our near and dear ones. Not a day passed in the last couple of years that we've not got up to, sad news of somebody suffering from COVID or a near and dear one passing away. It's almost 2 years into the pandemic, and it's now time to take stock of how healthcare and life sciences manage to cope with such stress and also discuss strategies that have been developed to address those gaps and vulnerabilities that were witnessed during COVID-19 to ensure that these are not repeated. The pandemic has definitely created an unprecedented situation and a very uncertain time in global health. But at the same time, it has created new opportunities for future partnerships towards robust solutions in healthcare. As the tagline of this series goes, it's time to reimagine the future, and the time to act is right now. With that, let's start. A line of introduction about myself. My name is Surabhi Pandit Nangia, and I am the Director, Outreach and Partnership with Data Leads in Delhi. On behalf of Team Data Leads, Health Analytics Asia, and our partners, SAP, I extend a warm welcome to all of you present in here today. Why are we here? What brings us to another talk? What brings us to another session? The Health of India series presented by SAP is convened by Health Analytics Asia and hosted by Data Leads as part of a Pan-Asia Health Dialogue initiative to build a committed and a stronger platform for strategic collaborations in the ever-evolving areas of health and life sciences. With these series, we aim to bring together, we feature health ministers, policymakers, CEOs, thought leaders, technologists, journalists, as past participants, as our speakers, in high-level deliberations on health with focus on innovation, technology, and policy making. Spread over 8 states, the series will highlight pivotal perspectives of the states that drive India forward, promising to shape the country's healthcare and life sciences ecosystem in the years to come. I want to take a moment on introducing Data Leads. Data Leads is the digital media and information initiative, which our aim is to help people understand and engage in the world around them. Our work spectrum ranges from capacity building initiatives, fact-checking initiatives, media research, data-driven content, and events with a special focus on building collaborations in public health. That is our primary work. We are also proud partners of Google News Initiative and Internews in launching pioneering information literacy and fact-checking initiatives in India, which has benefited over 1,300 newsrooms and 700 universities across India. One flagship project of Data Leads is Health Analytics Asia, which is Asia's first data and health information platform building collaboration between journalists and doctors and technologists. Our approach under Health Analytics Asia is to build collaboration with doctors and globally recognized as a unique initiative in healthcare reporting, and has won. I think we're really proud of being winning the membership puzzle project by the New York University. And in fact, in the past, we've also been awarded by the prestigious British Medical Journal Award, and we are so proud of it. Moving on and starting the session, I will take a moment on the agenda, keeping in consideration that there is so much of fatigue and people are really tired of online sessions. People are witnessing, because of all online and the Zoom webinars and the conferences, we've tried our best to keep the agenda as crisp, as short, and as focused as possible. We'll start with the introduction. I'm almost done with the introduction, and with that, we move on to the keynote address. This will be followed by a panel discussion on reimagining the future of health. We will do a quick poll survey and then start with the flash talk session. After every session, after the first plenary session, we will do a 10-minute question and answer session, and same is going to be with the flash talk session. We will request all our participants, if they have any questions, they can post it on the Q&A box down, and we will take the questions. This is a webinar mode just to ensure that, sometimes consciously and unconsciously we keep ourselves on unmute, and it just gets a little disturbing for the speaker. So this is a webinar mode. We're going live on YouTube, and this session is being recorded. So here is a proud moment to present this edition on Uttar Pradesh. Who better actually to set things in motion than our Honorable Health Minister of Uttar Pradesh, Shri Pratap Singh, who's our keynote speaker and who shares his thoughts on the state's fight against the pandemic and the road ahead for health of Uttar Pradesh. With that, it's over to you, sir.
A part of Health of India Uttar Pradesh Summit, which is organized by Data Leads, and we are talking about the health of Uttar Pradesh and the health sector. Uttar Pradesh, being a very big state, has a population of 24 crores, and we have a huge public infrastructure which has been prevalent for some time. And when we came across COVID-19 on the 8th of March 2020, our health infrastructure as what it was did not seem enough to combat the pandemic which was coming in a wave. We went along as the pandemic came, and under the leadership of our Chief Minister, Yogi Adityanath, we first started increasing our testing machines. When we started, we had only one machine which could test about 70 cases in a day. When the first cases came, we had to shift them to Safdarjung in New Delhi, as we did not have a full infrastructure ready. Since then, from 70 cases a day, today we have increased our testing capacity to 4,20,000 cases a day. And from a meager 1,000 beds, we increased the capacity in 2022 to 1,50,000 beds of different categories to combat the pandemic, which was L1, L2, L3. And from 2020 to 2021, the worst of the pandemic, we continued monitoring and improving our management system and expanding our base through our field workers in the health department, ensuring that medicine supplies were supplied to each and every household. Also ensuring that in 2020, when we had an influx of all our migrant laborers, which eventually came to almost 35 lakhs, and each migrant labor was, in each district there was a proper setup which was initiated by the district authorities, each laborer was recorded, his temperatures taken, his oxygen levels taken, and thereafter we ensured that he was put into home isolation. We also ensured that he was given 1000 rupees in his account directly, and we also ensured that we could give him rations for at least 1 month. We also, with the help of the Prime Minister, ensured that all our oxygen supplies came from faraway states like from Jamnagar, from Bokaro, from different parts of the country where we were allotted, and we picked up 800 metric tons of oxygen cylinders or oxygen tanks, liquid oxygen also, and we ensured that during the entire pandemic of 21, our government hospitals were well equipped with oxygen so that as much beds were available with all our hospitals, we tried to ensure that there was as much less deaths as possible. So it has been a tremendous experience as far as COVID pandemic is concerned, and we learnt along the way. And I would like to say this, that along with our management, we created a ICCC, which is called the Integrated Control and Command Center in each and every district, which ensured through the call center that every household was connected, every positive patient which was under home isolation was called upon and given doctor's consultation, and we had rapid response teams which went to these residences, made sure that at least in 10 days, twice in 10 days they were visited upon, gave them sufficient medicine, gave them oximeters and infrared thermometers, and in case there was a change in their temperature, then they were shifted by ambulances to the required hospital. So when we started upon this system, and we perfected to such an extent that from 2020 and 2021, and after May and June of 2021, and today also, we continuously do a testing of 1,80,000 to 2,20,000 per day of RT-PCR and rapid antigen tests. We also ensure that anywhere, whether it's at the bus stations, whether it's at railway stations, whether it is at the airports, even at busy marketplaces, in agriculture mandis, on the street vendors, thela-walas, rickshaw-walas. From time to time we do these testing so that we ensure that there is no COVID positive cases coming in, and if we do find any positive cases coming in, we have a strict management system which ensures that the party which is infected is properly, his entire family is also contact traced, and so we show that there are no other strains also. At the same time, we are also doing genome sequencing, which gives us some insight into different types of strains which are coming into UP also. But at the moment, after confirmation from ICMR, we have found that the strains which have come into UP from different places are not as aggressive as what we feel. Also at the same time, ever since from 16th January of 2021, we have started with vaccination, and today we have done more than 12 crores 15 lakh vaccinations. We've done about 8 crore plus families which have been tested for COVID testing. So between the testing and the vaccination, we've already covered 63% of people who have been vaccinated once, and about 17.4% people who have been vaccinated with the second dose. We are confident that as of today, for the last 3 months, we rarely have a case of from say 5 cases a day to about maximum 25 cases a day. We barely have about 113 or 115 positive cases in the hospital and home isolation. And as we go along, I would like to say that now that in the last few months we've been taking care of all our health infrastructure which is already there, and to ensure after the COVID pandemic what sort of improvements we can do. So one of the first thing which we did was, under the Prime Minister Care Fund, the PM Care Fund, the Chief Minister's Relief Fund, MP MLA's funds which were given to us, we ensured that district hospitals, medical colleges, community health centers have been provided with oxygen generating plants, oxygen concentrators, pediatric ICUs, SICUs, NICUs, pediatric trained doctors, and wherever we had a problem, we ensured that doctors and medicine are available even today at the lowest level. And as of now also, we are increasing our health infrastructure with the help of the central government. Two schemes which have come out, and as everybody knows that in the budget which was presented, the health budget was presented in 2021 in February, the Prime Minister said also that 127% increase will be in the health budget infrastructure. So out of that, we are going to be increasing our community health centers, which has a 30-bed hospital, to about 50-bed hospital. Our primary health centers, which is about 4-bed hospital to about 10-bed hospital, with proper new machines like digital X-rays, ultrasound, modern lab testing systems at the district level, ensure that all our digital X-rays are there, CT scan machines are put up, and dialysis is also being done at most of our district hospitals. And as you know that Uttar Pradesh is already going through a lot of diseases which happen from time to time due to heavy downpour, due to monsoon, due to heat waves. We have, as of now, dengue, we have chikungunya, we've gone through malaria, Japanese encephalitis, which is in 38 districts of Eastern UP, which is now totally controlled because we have a inter-coordinated departmental system which ensures that our field workers go down to each and every household, just like what we did in COVID, and 100% vaccination for children for Japanese encephalitis, AES, Kala Azar, and so many other diseases which have come on the way. Everyone has its own management system, and we are confident that in the near future, that the way we are going about improving our health infrastructure, improving the manpower, improving the training facilities for all our doctors and for our paramedical staff, that in the coming future, you will see a much better Uttar Pradesh, a much better coordinated Uttar Pradesh with a good health infrastructure, with trained doctors and paramedicals. Uttar Pradesh is changed. Uttar Pradesh is much more modern, much more efficient, and has a good accountability system. And I'm sure that in the near future, Uttar Pradesh will be delivering a very solid, good health infrastructure and health services to the people of this state. Thank you very much.
Thank you so much, sir. That was really, really nice hearing from you. And it's really inspiring the way Uttar Pradesh actually pulled back the pandemic, and not only the pandemic in the past, the diseases that have been life-threatening. We are truly, truly honored that you took out time to be here with us for this important discussion. Thank you again on behalf of all our speakers. Extend a really warm thank you to our Honorable Health Minister of Uttar Pradesh. With that, let's move on to our next session and setting up the stage for our plenary session on reimagining the future of health. Our goal here is to bring you different set of perspectives from different experts who will share their ideas and vision about the challenges and new opportunities ahead in healthcare. The idea behind this is to drive collaboration and partnership to come together and make a dent in this huge challenge that we are all facing today. We have 6 most eminent speakers who've been really kind to join us today for this session. And I take a moment for a line of introductions for our most prestigious panel. To begin with, Dr. Gyanendra Singh. Dr. Singh is the chairman of Growth Pharmaceuticals. Dr. Singh has previously served as India's Drug Controller General and was a member of the WHO Expert Advisory Panel on the International Pharmacopoeia and Pharmaceutical Preparations. Thank you so much, Dr. Singh, for joining us. Dr. O.P. Yadav. Dr. Yadav is the CEO and Chief Cardiac Surgeon at National Heart Institute. He has previously served as Founder Chairman, Department of Cardiac Surgery, Dharma Veera Heart Center, and Sri Gangaram Hospital in Delhi. It's such a pleasure to have you here with us, Dr. Yadav. Our next speaker panelist for today's session is Dr. Anand K. Dr. Anand is the CEO of SRL Diagnostics. He has over 25 years of experience in diagnostics and laboratory services and has formerly been the CEO of Newberg, Apollo Diagnostics, and CEO at Metropolitan Healthcare. Thank you so much, Dr. Anand, for taking out time for this important discussion today. It's such a pleasure to have you here with us. Our next speaker is Atish Majumdar. Atish is the president of Mankind Pharma and is responsible for the company's specialty business. He has previously served as Vice President, Sales and Marketing at Lupin. Thank you so much, Atish. We understand the given time constraints. Thank you so much for joining in. Abhijit Banerjee is our next speaker for the session today. Abhijit is the Chief Implementation Officer at the Finish. Financial inclusion improves sanitation and health. This is what Finish is. He is also the country coordinator for Finish Mondial in India. He works closely with the country's Ministry of Water and Sanitation and private stakeholders to improve rural health indicators through proper hygiene. Thank you so much, Abhijit, for being here present today. Our next speaker is Indudhara Basavraja, who is the Industry Customer Advisor at SAP. Thank you so much, Indudhara, for joining us. With that, it's over to Syed, who will start the panel discussion. Thank you so much, Syed.
Hi, thank you so much, Surbi, for the kind introduction. And I'm really glad to have this distinguished speaker joining us for this very important discussion. It was quite insightful to hear what the Honorable Minister was saying about the condition of health systems in UP and what it meant when the COVID hit all of us and how the state responded or is responding and how things are changing to improve things for the next 10, 15 years. So I feel like, we are it has been a devastating situation the last 2 years. We've never seen something like this. But I think every difficult situation creates new opportunities. And the challenge is whether we are investing to avail those opportunities or not, even in the bad situations, and whether we are talking about solutions or not. There are problems. We're all aware of that. It's a big, complex country. It's a diverse country. There's a lot of scope to improve things on healthcare, on health delivery, on pharma. But what are the solutions? How are we looking at next 5, 10 years, or maybe 20 years down the line in terms of our health services delivery, for that matter, how pharma is responding to the challenges and reinventing itself? What are the key things which are happening on as basic as hygiene, actually, basic hygiene? How are we as a country improving our overall health care and public health? I think we're having an amazing list of speakers here all joining us for this very insightful discussion. I will keep it very simple. We have 40 minutes, 45 minutes for this session. I will request each speaker to make an opening remark, and then I will follow up with 1 or 2 questions. And at the end, we will come up with the 1 key recommendation for the state health ministry or for the union health ministry. So if I start, Dr. Yadav, with you, you heard the Honorable Minister, and he was saying when they started testing in Uttar Pradesh, when the COVID hit, there were hardly 17 is testing done in a day, and now it has reached 4 lakh. And then he mentioned about how infrastructure is being improved across the state and district levels. How do you see the key learnings from the pandemic? How do you have been there, you have led number of initiatives at different places, you have been serving, and you have been outside in India as well, you've served in India as well. How do you see overall healthcare challenges we are facing today, and how do you see the future 5 and next 10 years?
Well, thanks, Syed. Yes, I enjoyed the talk of the Honorable Health Minister. And besides the platitudinal, increasing the GDP, as he said, 127% increase, increasing the infrastructure, and all those things, the manpower increase, the resources. I think it's very important that the technology, which has now reached the tipping point, has to be harnessed. And that's in fact, the flavor of the times, shall I call it, the zeitgeist. See, we looked upon during my days that talent was the most important thing for success. But today, I think technology is as important as the talent, and we need to provide for that. And the ecosystem developed at a warp speed, from 1,000 to 1.5 lakh beds and all those things. But most important thing here was inter-sectoral collaboration, and that is what needs to be done. We need to empower people so that inequities are removed, the rural-urban divide, the rich-poor divide, that has to be taken care of. And lastly, I want to say that we should offer politically agnostic health messaging to increase the uptake of health by the public. And what I mean in this is, I'm sorry, I might be touching a raw nerve, maybe raising a red herring in this, that everywhere we see political overtones, even in health, and that should go away. And if we do that, moving forwards, I think the future is bright, and we need to, instead of bemoaning what has gone wrong, move forward with this inter-sectoral collaboration. Thank you.
Thank you so much. Dr. Singh, how do you see how we responded, and how do you look at the future?
Thank you, Dr. Ji. As the Honorable Minister and Dr. Yadav rightly mentioned, the intersectorial approach is the right thing which requires to be emphasized by the Government of India, all the stakeholders. As we know, health is wealth for the people of a state, and when intersectorial approach is being mentioned, networking, cooperation, reliance among stakeholders are the key of the success. The right standards for the drugs, pharmaceuticals, and we are very fortunate that the Government of India has established Indian Pharmacopoeia Commission, which at par with most of the standard setting institutions of the country. We are having a very robust regulatory system put in place, as the Drug Cosmetic Act 1940 rules, they are under 1945, they are old. We are going to have a new complete change in the regulatory system and landscape so that the current issues could be addressed properly. On the educational institution front, the UP government has taken various initiatives. As the Honorable CM has rightly mentioned, each district would have a state-of-art, the medical college, with the paramedical institution. I think these are going to change the dynamics, the landscape of the UP. If the pharma sector we want to address particularly, few years back, the UP was one of the most neglected states. We were consuming drugs and medical devices of the tune of about 40,000 crores. Now, the government of UP is going to create infrastructure, state-of-art, for production of the drugs, active pharmaceutical ingredients, starting key materials, and other allied chemicals. We are going to have a state-of-art infrastructure facilities for medical devices that Government of India has already approved. We are thinking that once we address the vaccines issue, how the production of vaccines and biologics could be addressed suitably. I think, and I am looking forward with great expectation that UP is going to change the dynamics of the healthcare sector, and the pharma sector will be playing a very important and appropriate role. In the last, I will be mentioning the networking, the reliance, and the proper understanding among the institutions. UP is having a very good institutions, but this intersectorial, intra-sectorial cooperation is our of need. Thank you.
Right, wonderful. Anand, how do you look at how diagnostic industry actually responded to the pandemic, and what are our key learnings from that experience?
Thank you, Syed. I think, as you rightly put, it's a crisis which we have seen, and as you always said earlier as well, the crisis presents an opportunity. And we are all, I think, the entire healthcare system, whether it is hospitals, whether it's the government systems or the private sector and the diagnostic laboratories, have come to the risen to the occasion and did what they can to combat the pandemic. So what we have seen is, like what the Honorable Minister was saying and Dr. Yadav was saying. So we started with something like, if you take the case of labs like us, we had probably just 2 labs in March 2020 for testing RT-PCR for coronavirus. So currently we have 20 labs. We have recently launched a lab in Allahabad in UP as well. So our testing capacity from starting with, we had about doing about 200, 300 tests per day. And so today we have a testing capacity of close to about 70,000 tests per day. And, during the second wave and all, it helped us a lot in, helping people and giving solutions early. So what I feel is that this pandemic has also put in the forefront diagnostic industry, because earlier diagnostics was a sidelines of healthcare, you can say. Because if you see, it's even though out of the total healthcare spend, diagnostic spend is hardly 5%. But if you see in terms of clinical decision making, 70% of the clinical decisions are based on diagnostic test reports. So it's a very critical part, and it has been highlighted. And it also brought to the forefront the requirement for accreditation, the requirements for quality in diagnostic services. So this has also helped general public to be aware. So we know people talking about NABL, people talking about ICMR. So it's like it's become more a common parlance to talk about such things. So another important aspect, if you ask me, is also that, the number of labs that were there earlier, even in the government sector, for these kind of high-end stuff like molecular biology, that has increased a lot. So that means that, more and more manpower is required, skilled and trained manpower is required, because these are not routine labs. And we found that that's a very important aspect. And this actually gave rise to an opportunity to provide opportunity for more people to come to work. So we had more people getting into molecular biology streams, learning the things quickly, and then becoming a part of this whole lab process. So I think that is another important aspect where I think we need to improve our training, bring more people, skilled labor into this, and that government can help and cooperate with the private sector for this. Another important aspect is the public-private partnership, which is very critical. If you see most of the locations, the private sector has also contributed in terms of augmenting the resources required for testing in each of these states, especially in states like Uttar Pradesh and Uttarakhand. We have seen a lot of collaborative efforts happening, and I think those things have to continue and take it to a next level.
Thank you so much. Atish, if I come to you, you're leading a major pharma company in the country, and you have been deeply involved in terms of being at a front lines of providing services actually to the different stakeholders. How do you look at from the pharma industry point of view? Where do we stand after this? We are still in the pandemic. And how do you look at the future, next 5, 10 years? What are the key changes or trends you're observing from a pharmaceutical company point of view?
Yeah, I think COVID came to us somewhere around March 2020. And since then, this small virus led to a tectonic shift in terms of the way we approach healthcare. From an economy which is mainly illness care, people fell ill and we treated them. I think COVID brought about a shift in our approach, and today, marginally, at least, we are thinking of healthcare more than illness care. And if you go back to history, men has always fought wars based on land, power, and we were investing big time in protecting our borders. But I think the war is now come to our bodies. We are fighting what is within. And that kind of is an inkling to what is the future is going to be like, right? Governments across the world needs to invest more on healthcare, be much more proactive, and like everyone said earlier, need to be much more collaborative in their approach to maintain healthcare for the general population. 100 crore people got vaccinated as on yesterday, and that kind of is kind of a glimpse into the future of India and the Indian pharmaceutical industry. In many ways, I believe that. The industry today is pegged around, at 21, is pegged around $42 billion, expected to go in 24 to somewhere around $65 billion and $130 billion by 2030. These figures are mind-boggling. And this only if we grow at the current CAGR of 10 to 12%, right? This is how the industry is set to grow, driven by multiple factors. The first being domestic consumption is definitely going to increase in India. Awareness is something which always drives healthcare as well as the pharmaceutical industry. Affordability, I think India gives a competitive edge to the Indian drug industry or the Indian pharma industry as far as the economics go, right? And also accessibility. We have seen that really grow, and the growth of diagnostics. Diagnostics and disease management grow together. And just like Anand just now said, that 70% of decisions are made based on diagnostic tests, and that is a fact. So this is definitely going to drive growth for the Indian pharma industry, aging population, driven by NCDs, non-communicable diseases. And the fact is that we come out of an acute, just come out of a pandemic, which is a communicable disease. Yet, parallelly, we have seen the complications of COVID literally drive the growth of non-communicable diseases, right? So diabetes, we are sitting on, people have taken so much steroids, so you're perhaps looking at a lot of people getting converted from pre-diabetes to diabetes. The coagulation part of the COVID infection is still being understood, but we do understand that all COVID patients literally need to be given anticoagulants. So again, prevalence of NSAID is going to really, really drive pharma industry. Also domestic spending, with the economy growing, the domestic spending has definitely gone up. And we are really looking at 8 to 11% going up in the next 3 to 5 years. In addition, I think the patent cliff, which we talk about, nearly $251 billion drugs going off patent in the next 5 years, and which again, we being the pharmacy of the world, I think we are geared to kind of exploit this. We have seen one drug recently go off, dapagliflozin. Prices drastically came down by 65%, and the usage has definitely gone up. Also, globally, one of the big growth drivers is going to be biosimilars. And again, here, preventives, targeted therapies are going to drive the growth of the Indian pharma industry. And I think India is very well poised over here. We today make 62% of the world vaccines, right? And this industry, the biosimilar industry is set to be somewhere around $60 billion. If India can take 10% of that, we should be able to hit a growth rate of 13% and cross that 130 billion. Also, innovative drugs and next generation therapies are also going to drive growth of the Indian pharma industry in the next 9-10 years. I think Indian companies have started making inroads here. And just recently, you would know that Mankind, through its GPR 119, we got a worldwide patent for a new drug in diabetes, completely new pathway till 2037. And I think this is the kind of innovation around NCs which you will see as we go ahead. Even last year, 2019, actually, we cracked dydrogesterone, the second company in the world to crack a very old molecule, but a very complex molecule, but Mankind did that.
Right.
So we will see a lot of work around these areas. And I think Indian companies are poised to drive innovation, right? Besides that, technology, like Dr. Yadav said, is going to be a very big play, right? Technology
I will come to on technology in the second round, because that's such an important element.
Absolutely.
What we're talking about future. Let me go to Indu, to you. Actually, you're a technology. Like your company is SAP is a leading at a forefront in terms of helping companies lead the technological transformation. You're not able to share your video. I understand there's some glitch, but no problem at all. How do you see the next 5-10 years when it comes to using technology for hospitals, pharma companies, diagnostic companies? How do you see technology playing that critical role?
Sure, Syed. First of all, thank you so much for having me as one of the panelists among the esteemed and expert speakers in today's session. It would be my privilege to share thoughts on technological impact on healthcare and life sciences verticals. Healthcare and life sciences have always been fairly good adopters of technology, but I feel that pandemic has been an accelerator in this particular sense, right? So we have seen that every organization is now looking at how do I, maximize the utilization of technology, which can help me in my outcomes, right? And totally, if you look at healthcare as a vertical, what is very important from their perspective is how do I improve patient experience? How do I subscribe to patient outcomes? How do I operate very smartly and efficiently? How do I take data driven decisions? And how can I empower my workforce? So these are the five major things that we see in the healthcare industry. And in the age of coronavirus, medical technologies have certainly captured the public imagination like never before, right? So we've seen ventilators, respirators have saved thousands of lives, etc. Right? So, and officials at airports, public places have been using contactless infrared thermometers to screen crowds of visitors. There have been, fingertip sensors, how you can alert patients to any dangerous drop in their blood oxygen levels. Clinical devices are now often very smart and are connected digital networks, which are becoming every day, right? In the coming years, we certainly expect to see such technologies become integrated into smartphones, into wearables, just like, any satellite navigation apps are replacing standalone devices. I mean, look at the apps today that we have, right? From Arogya Setu app or the Coven app, wherein you have big data coming in. You have a lot of data coming in for monitoring, for analyzing, for tracking, for predicting. On the people side, there are variables which can, detect my blood oxygen levels, my BP, complete health monitoring. There are online platforms like Practo, which are coming in and connecting doctors and patients, right? Once people step into hospital, there is technology for patient registrations, rooms and bed tracking, tracking of medicines, billing, etc. And of course, to manage the complete complex supply chain, production capacities, ensuring that critical medicine supplies are made to people is very, very, pertinent. And if I look at, people or patients, if I have to get my medicines delivered today, I just look at, apps like PharmEasy, MedPlus, 1mg, etc. So the role of technology is certainly very, very critical in today's world. And going forward also, we see that a lot of newer innovations are happening in the technological space. We have seen utilization of newer technologies like artificial intelligence, machine learning, IoT, big data, industry 4.0 concepts, being proposed in this particular sector as well. And we at SAP are also, happy that we have played a very small part in terms of having technology play an important role in the healthcare and life sciences industry towards innovative solutions, right? We had a very small vaccination collaboration hub, which could, help track entire vaccine end to end, provide the vaccines in the right quantities at the right time, at the right place, with a very low supply chain cost. So what I would summarize is certainly the role of technology is relevant today, and also in future we see a lot of pertinent role of the technology being played in this particular vertical.
Right. Thank you so much. Abhijit, let me come to you. You're a person on ground. You work with communities across UP and in other states, and you work really on something as basic as hygiene and sanitation. And so how do you see the public health learning from the pandemic, actually?
Thank you, Mr. Nazakat. Firstly, it's so wonderful to be here, a person of shit in a room full of health professionals, and also a person from SAP, a technology area. So it's wonderful being here. And as you rightly said, I'm the person on the ground. We have been working on sanitation since the year 2009. And we got into sanitation primarily because we feel that sanitation could have a direct impact on health, and particularly the behavior, the change in hygiene practices. So that's where that's where we see the impact, as far as particularly if you talk about COVID in today's times, in these difficult days, the impact of the basic things like hand wash and using proper toilets. So these kind of, while they're very basic, but I suppose that was the crying need also of the country. And thanks to the Prime Minister, there has been a tremendous amount of focus, and we find a lot of change that is there on the ground today. While there is a lot of ground still to be covered, there are, of course, gaps. India is a very large country, very diverse, and there are different types of challenges also on the technology side. But still, I think we have reached, we have done very well. And there are possible, now one can see when I visit the villages, the areas that I have visited about when we began the program in the year 2009, and when I visit the same territories today, I find a perceptible change. So that is really, and it is not only appreciated here, that when I meet people, but then it is also appreciated globally. Finished today, we began the program. Just to share with you all, the Finnish program began in the year 2009. Thankfully, Surabhi, while introducing me, she elaborated that it is financial inclusion, and we are not here to finish anything other than the open defecation status, because we were at one point of time, we were on the shit top list. We were the nation which was shitting most in the open, right? Globally, like that was the data. So we began the program. I left the Tatas in the year 2011, and while the program itself we conceptualized in the year 2009. And since then, by 2019, we had reached out to about 1 million families, and we used financial inclusion. Basically, we used microfinance and bank finance to drive sanitation in the country, because it's been our belief that people, those who can, and they are willing to pay for a toilet, for a proper facility, it could also help reduce the burden of the government. So these 1 million toilets we completed in the year 2009. Along on the journey, the program migrated to Finnish Kenya. So that began in the year 2014. In the year 2020, we conceptualized it as a 6-country program. So Finnish today is not only in India, which of course remains the largest center, but we have 5 other countries in the fold. And globally, the idea is to reach out to about 4 million families by 2025. Thank you.
Right. Thank you so much. That takes us to our next session. And if we have audience also joining us on YouTube, if you have a question for any particular speaker, please post in the chat box or on a YouTube link, and my colleague Surbi will read those questions for speakers at the end of this session. So I'm now we're thinking about we discussed it, we have done quite well, and we are somehow emerging from a second wave. We're still not certain how next 1 year will play out. Globally, there's a lot of concern about recovery and how we will deal with the situation. But there's a good thing is that, and which is heartening, that it is for the first time ever, at least in India, all of us are talking about health. Politicians, bureaucrats, doctors, everyone. It was very tough to convince people to understand why is not health a political issue in this country? Why are not we fighting elections on health, on all these issues? But I think today the best thing out of this crisis, difficult situation, is that there's a larger understanding that we really need to invest more and improve our systems of healthcare delivery, of services, so that people stay healthy. And there's also a global discussion about preventive medicine, that in future, perhaps we need to be healthy instead of getting treated for any particular disease. Dr. Yadav, how do you see prevention actually in the given global situation, and also the conditions we have in India, given heart diseases still have a very high mortality cases from India? How are we going to help our people to have more preventive measures so that they don't fall sick?
Well, thanks, Syed. I think the word has now to change from prevention to promotion. Mm-hmm. And instead of preventing things, we need to promote health. And that is a paradigm shift which needs to come. And things like your own Health Analytics Asia, as Surbi just mentioned, combining doctors, journalists, and technologists in one all-encompassing platform that we develop technologies which will improve the health seeking behavior, and then the journalists disseminate into the population to the last mile, to the last person, would be the right thing to do. As far as prevention and promotion, I think empowerment of the person is most important. And the empowerment is not just economic empowerment. Empowerment is political empowerment, empowerment to think, empowerment to get knowledge and health-seeking behaviors. Those are very important. And lastly, this pandemic occurred almost 100 years after the last. But going forwards, we're going to see more and more of them. There are hundreds of zoonotic viruses sitting across the fence, ready to jump into a human being. How do we reduce the human-animal interface? Those are the kind of thoughts which will help us move forward towards prevention and health promotion.
How do you look at preventive medicine or prevention of diseases from a diagnostic point of view? That people going for a routine screening every year or a regular intervention, has there been an understanding how that is helping us to prevent a lot of diseases?
Oh, sure. It's a big thing now. We have point of care testing where an individual can do it himself. There are, machine learning and artificial intelligence. You look into the mirror and you will get to know what's your cholesterol level from what is deposited under the eye. You have toilets where you pass urine and the sugar level is detected. So you open the fridge, you will get to know, and a warning will come, look, you have opened the fridge, you're not supposed to open middle of the night to eat. So prevention technology will come a big way.
Right. Anand, how do you look at from diagnostic servicing point of view? How will diagnostic players will chip in and help in terms of preventive medicine for that matter, helping people to see diseases before they harm them?
Right. Syed, as Dr. Yadav said, yes, promoting preventive health, promoting health itself has become a very huge priority. And that has been fast-tracked by this pandemic. The awareness and the health-seeking behavior in the general public has definitely increased. There is an outlook for safety as well as for hygiene when it comes to choosing healthcare facilities, whether it is for as a hospital or whether it is for even for a birthing center or a diagnostic service. So there's a lot of focus on that. And with preventive health, we have also seen that, whenever the pandemic recedes, sometime, we had lull phases between the first wave and the second wave. We found an uptick in, the preventive health packages, people going in for more preventive health checks. As we also know, this pandemic has also put the non-communicable diseases on the back burner because, the patients who are normally doing their regular tests, they were not able to come out and get those tests done. So the role of preventive health is very, very critical, and bringing it closer to home in the form of wearable devices, in the form of point of care services, as well as something like a home service. Like, in the pandemic, we have also seen that, 2.5 times or 3 times increase in home collection requests. So like we go home and collect the samples from the patients. So and this services has become a very important requirement during the pandemic. So I think these are the various aspects, and another important thing is the digital, the thing that has happened over because of the pandemic. So what we see is the adoption of digital technologies, both by the general public as well as by the healthcare companies, has been quite good. And more and more people are using the apps and then choosing packages for themselves and getting those tests done from home, and then accessing those reports on the web, and then using tracking information, using longitudinal reports, using synoptic reports, and trying to combine all the data and get something good out of it. Like there is a lot of analytics happening, there is AI and ML happening in the background to get this make sense out of the data that's getting generated. So I think there's a lot of work that's happening in this space, and I'm sure that this is going to be a very critical space, an important space going forward.
Wonderful. Atish, I will come to you, but please feel free, anyone, if you want to make a supplementary point. So don't wait for me, but I think it's like, let's have that way in the discussion. Atish, how do you see the role of data for pharma? Like, how do you use it? The way maybe, for example, 10 years down the line, 20 years down the line, how are you using data in terms of your business understanding, in terms of improving your services? And do you see any improvement how pharma companies use data to reach out to people and improve their, the medicines and products? Adish, your microphone is off.
I'm sorry. I think there's a huge improvement, and I think pharma companies, not only ours, but across the industry, is leaning in towards greater data awareness, data capturing, data mining, and data usage for sure. Pharma is but a set of conversations at the customer interface, and there is no way we are capturing those conversations, right? And so I think there is a lot of work being done on that front. We are trying to see how we understand this conversation so it kind of paves the way for the next conversation. That's one part of it. Our customers, doctors, are driven by evidences. I think we live in an area where evidence-based management is what doctors do when they manage diseases, especially in the NCD. And these are all driven by data, right? Pharma, the way we manage our supply chains, here again, data becomes critical to improve efficiencies. And so,
do you hire data scientists for your companies?
We do hire. I think this was something. See, we were all thinking of going digital, and now we have all got digital with the COVID thing coming in, right? So today, and with the cold chain products also coming up, your data visibility right across the supply chain becomes critical, right? So I think there is much greater awareness as far as data goes with the rise of IoT, AI, machine learning. These are critical to pharma. Pharma was away from data for quite some time, but with these coming in, I think we are just leaning into data. We have a long way to go, but we do understand the importance of data in business today for sure.
Right. Dr. Singh, a lot of things in India don't work, and people say that don't work because of bureaucrats. And they don't keep the same pace the industry requires, the people require. And you have been, leading a number of initiatives as a key person out there. How do you see actually bureaucracy responding to the challenges of healthcare industry? Are they quick? Have they improved the way the approvals work? How is your experience being at the top and improving things?
Thank you, Natakaji. And your point is well taken care of. The people in few years back, people were thinking that regulatory pathway and the bureaucratic system is not responding as per need of the nation. But after 2012 onwards and 14 particularly afterwards, the things have dramatically changed. Now the mindset of the regulators, the bureaucrats, the system have completely, I have seen sea change. Now
what changes have we seen?
With technology platforms, earlier we were collecting the documents, the feedback through the papers, through different modes. Now everything is online, even the approval of the licensing, having totally online at the CDSU. We are collaborating with the WHO, and the vaccine success story, which you are seeing today, the foundation was laid down about 10 years back. We were declared as a stringent regulatory authority. All the indicators we passed, and this is how the success story have taken place. In the last, I will be mentioning, as Dr. Yadu in the beginning mentioned, about the inter-sectoral approach. I think now the multi-sectorial approach in different therapy requires to be connected properly so that most of the prevention wellness would be addressed suitably, and bureaucracy plus the regulatory system in the present mindset and the technology innovation would never be a hurdles which government has ensured and is ensuring on day-to-day basis.
Right. No, that's good to know actually, and good to hear from you. So from someone who was the leading, drug controller general of India. Like I remember meeting you in your office, and it was all some years ago, and it was all flooded with the files. And I'm glad to know the things digitally are working, improving the working culture as well. If I come back to you actually on telemedicine, how do you see that actually playing a role in next 5-10 years in India?
is the right answer of most of the issues for the proper addressing the healthcare sector for the people of India. And in this direction, the central government, the UP state government has taken very proactive measures. As our Honorable Health Minister of UP has mentioned, the Honorable Chief Minister wants that each and every institution of the UP be interlinked and utilize the facility of the telemedicines. Even, the US Indian doctors, they are very keen to cooperate, to participate in improving the health indicators of India. And I'm seeing a huge future with least investment and giving best services to the people of this country.
Right. Indu, if I come back to you,
there's
a lot of talk about telemedicine.
Sure, Syed.
And we've been talking about it from the last 10 years. Do you think that the movement has really arrived after this difficult situation, that we can see more investments, more use of telemedicine in India?
Sure, Syed. Adding on to points made by Mr. Singh as well. We feel that telemedicine is, the market in India. There's an expectation of telemedicine market in India to reach almost 5.5 billion by 2025, with a CAGR of around 30% and more. Right. So we see that telemedicine will certainly reduce the time of consultations and improve the quality of healthcare services, specifically in tier 2, tier 3 rural areas as well. So I feel that there's a lot of opportunities.
Have you seen any state doing well in telemedicine?
Oh, I think a lot of states, I would say, Syed, and typically when we see early adopters of technology, be it say a Karnataka government or be it Andhra Pradesh and Telangana governments, right? So they have been making use of such technologies to the fullest, I would say. There are scopes of improvements for sure, but we do see a lot of things happening on the ground as well when it comes to telemedicine and technology.
And Dr. Yadav, how do you see the future hospitals using technology? Will they be more technologists and data scientists in hospitals or more doctors?
Oh, well, one is what answer I should be giving and what I think is going to happen. And the second answer is what I wish should happen. Well, I am a 66-year-old man, and I still believe in the power of touch, the power of compassion and sympathy in healing. And I believe healing is better than curing. And technology, unfortunately, provides you curing and not healing. So going forwards, yes, technology, as I said, has reached the tipping point. It has got strategic importance, and the hospitals are going to become more and more technology oriented. Is it good for the future? Well, I'm not sure I know the answer. Personally, I think, no, that's not good.
But you're using a lot of technology at hospitals, right? The diagnostics and everything.
Yes. I mean, I belong to the field cardiac surgery, where it is entirely diagnostics, therapeutics. Everything is technology oriented. Our heart-lung machines, robotic surgeries, our visualization.
If Dr. Yadav, I put this question like this way: what do you think the future doctors, when they study MBBS or MD or surgery, how should they be taught to adopt technology and data to a new world of treatment, actually?
Well, the new education policy is it's bringing out that collateral subjects should be brought in at any and every level. And the same is true for medicine also. So there should be teaching in terms of technology, in terms of computer sciences, in terms of artificial learning, virtual reality, augmented reality, nanotechnology. All these things are already creeping in the medical education now. And small time, directed classes are being taken on these subjects. So they are becoming a part and parcel of our training curriculum.
Yeah, Abhishek, I will come to you with a public health question. Given the situation you were saying, as basic hygiene, actually, and if we do not have that behavioral change in the country or with the people, the disease toll is going to increase. That could be any disease for that matter. How do you see the role of actually data collection on the ground in terms of understanding the disease toll and then linking that with the public health?
We are fully invested in this idea, primarily because we work with impact investors and outcome payers. Now, when you look at this financial world, it's all data driven. Unless and until we are able to provide them with the right set of data and timely data, it does not work. And since we are looking to bring in about 200 to 250 million dollars over a 5-year period, along with that approximately about 2% as outcome funders, they're basically interested in this because ESG is big with them. Right, and for ESG to really translate, to get it translated on the ground, these kind of matrices are required. So in the first phase itself, we started a partnership, as academic partners, we had UNU Merit from Maastricht and IFS London as, academic partners. So it's been like, it's been in our DNA. So, and currently we are using a digital tool to see that, data is collected, but where, what we want to further look at is basically the intersects, with the different sectors. As I've heard the earlier panelists and speakers also talk about it, basically looking at the interface of sanitation and health. And in fact, in that area, we are doing a telemedicine program. It was interesting to hear Indu talk about it, in Odisha, near Chilika, in that area, wherein, we are trying to improve the sanitation density and look at, health data. So we have got these ground level health workers. We have trained them. We have partnered with a Bangalore-based telemedicine company, basically for the back-end infrastructure, and also with a diagnostic service provider there. So we are trying to create that platform so that the data can be collected and we are able to triangulate and see, empirical evidence of this, the impact of sanitation on health, and whether that data can then be used in the financial services sector to bring down risks. Because when we work on the financial services sector, we see that, when a person, say for example, for a bank or for a financial institution, a borrower, if he or she falls sick, then the person cannot, purely from a moral or a humane perspective, cannot pay back that loan because simply that poor lady will not be able to work. So there is there is loss of wages. So what can we do to bring that down, that risk down? So that is our objective.
Right. So
that's how we are trying to create that ecosystem.
Yeah, wonderful. And we're going to have we have some questions from audiences here. My colleague Surbi will help me with these couple of questions. But there's a question for, Surbi, you want to go ahead or? Yes, wonderful.
Yeah, please, absolutely, go ahead.
Yeah. So we have a question for Anand actually. The question is, other than increasing numbers, has the approach to diagnosis changed thanks to pandemic and long distance diagnostic services?
I think the approach, in the sense that, when it comes to overall, even in terms of policy making, what we find is the government has helped us in many ways in terms of, reducing the custom duty on certain imported kits and goods. So those things have also helped us. We found that, almost 80 to 85% of the stuff that we use are imported. So this is also going to give a push to Make in India as an important concept for diagnostics as well, which is currently not there. So those are the aspects which have also given us a push because of this pandemic in the healthcare, especially in the diagnostic sector. But what I'm also seeing is that we are also going more to home. So that increase in home collections, it's not just for COVID, it's also for non-COVID requirements, especially in the case, not only in the case of elderly or sick patients or transplant patients or immunocompromised cancer patients, but it's also that the general public are also more adopting, adaptive to home collection at this point of time. So that is going to be one of the key drivers for growth.
Right. This is a question for Atish. Given the culture of self-medication in India, do you see that as a challenge and a cause of worry?
Yeah, I think that is definitely a cause of worry. Medicines should only be taken under the guidance of medical practitioners. And so that is one area I think which you would have seen our campaign done with Amitabh Bachchan, where we are trying to educate the masses that medicine should only be taken under the guidance of medical practitioners. So that is definitely an area where pharma has to work upon a lot.
Right. And there's a question for Dr. O.P. Yadav as well. Why are we having so many heart cases in India, heart disease cases in India?
Oh, well, it's a technical question. We are genetically predisposed. Both the nature and the nurture are important with the kind of stresses of modern life, our changing of, epidemiological transition from the rural to urban areas, increased stresses of technology, all those factors, play in. And I think I'll leave it at that.
I see. And do we have any other questions from here?
Yeah, I think there is one more question. I think it says that, have all these new and easy diagnostic tools made people a bit paranoid as well?
Anand, you want to take it? Dr. Yadav, you want to take it that people go for a lot of tests on their own?
Well, certainly this is not advisable at all. And in fact, there have been studies, they have not been shown to be of any benefit. In fact, even our executive health checks now, we are scaling down on what should be done. We used to do PSA for prostatic cancer, that has been taken away. Routine screening with echocardiography and treadmill test without any rhyme and reason before any general surgery has been taken away by the international guidelines. So I certainly do not advise self-testing, but unfortunately industry, Atish and Anand may not like this. They are doing direct business to consumer marketing, and that's harming the cause.
Anand, how do you see it?
I agree with Dr. Yadav. So I think it's critical to have rationality in diagnostics, and we are always looking at options to how do you actually rationalize the packages and tests that we do for patients. So actually we have pulled down a lot of tests over a period of time, not only for as part of health checkup panels, but also certain tests even doctors prescribe. Even doctors, sometimes they don't know the relevance of those tests. They simply write those tests. So we have started an education program for doctors on relevant and appropriate use of diagnostics. I think that's also very critical, considering that 90% of the cost is out of pocket in India. It's important that we spend the money wisely and the right place. So I think that's the point we've taken, and we will work towards it.
Very good. No, we would have really, allowed to continue this conversation, but we are mindful of the time. We're almost there, but I will request certainly each esteemed speaker here to maybe make a quick recommendation, either to the Health Ministry of India or Health Ministry of, UP or Uttarakhand, about what is the one thing you want to improve. And I will start with perhaps with Atish, actually, from a pharmaceutical company's point of view. What is the one key recommendation you will make to the government to improve things in your, sector? Your microphone, sorry.
I think the ease of doing business, I think that's what governments, not only in UP, but across the country, must drive. And there has to be policies which make pricing so much more predictable in the pharma industry, because then that leads to long-term investment. And special economic zones, which we are seeing, I think in UP, we have got the pharma park now going on. And we saw that in Andhra Pradesh also. Initiatives like this needs to be really, really driven across the country. And one suggestion more is that, governments across the country, not only in UP, must sing for the unsung heroes. I think we have seen the pandemic. We have seen what doctors have done, what nurses have done, what chemist people have done, I think, and if this is a war which is going to happen for a long time, the soldiers needs to be respected. And we need to see more educational colleges, medical colleges come up in the country. That would be my suggestion and submission to the government.
Wonderful.
Thank you.
Wonderful. Dr. Singh, what is your key recommendation to the government to improve things on healthcare delivery of pharmaceuticals? You have been there leading actually the show for, as a former director general actually of drugs. What is your key recommendation to the government?
innovation would be the key for success of healthcare sector. And I would be recommending there should be strong networking between academic institutions, industry, and national laboratories.
Wonderful. Dr. Opi Yadav, sir.
Well, I would say change the mindset. Instead of taking health as a center-left socialistic attitude, we should have a center-right attitude. Profit should be encouraged even in the health sector, even in the government institution, because that brings efficiency. And secondly, decentralize. We should have supply chains and innovation at the pin code level, not central level. Thank you.
Indu, what will be your key recommendation for healthcare industry or for biotech?
So coming from a technology space, Syed, so while I feel that we have already made a lot of inroads and we have stood up to the pandemic when, in terms of technology as well, but I certainly feel there is room for improvement. There is scope for improvement in technological adoption across different states of India. It has to be that, as a nation, I'm talking about the nation, individual states have adopted a lot to technology, but as a nation, we will still have room for improvement in terms of adoption of technology and things like that. Not undermining, Dr. O.P. Yadav's comment on how technology should be embraced vis-a-vis the human and the healing touch, but I still feel there is scope for technology, and at the same time keep in sync with the data privacy laws, and things like that, which will be very, very prevalent in days to come.
And what will be your key recommendation to the Health Minister of India or to the Health Ministry of the states?
Yeah, I think one of the important things that we learned from the pandemic is how public and the private sector can collaborate. I think that should be one of the key aspects that we should take this forward, not only in healthcare delivery, but also in terms of diagnostics, in terms of pharmaceutical delivery, as well as talking about healthcare education. So what we found is there's a shortage of frontline workers in healthcare. So we need to create more platforms for education where we can get trained nurses, trained phlebotomists, trained medical technologists who can be used by the facilities that we have created. And public-private partnership in healthcare is very critical to take the whole journey of healthcare forward across all the states.
Abhijit, what will be your key recommendation?
In fact, Syed, I have two requests. So one is, on the sanitation side, that the government should please continue with the focus, with the thrust that it had in phase one, because as WHO says that every dollar invested in sanitation results in $9 to the GDP. So it makes eminent business sense, economic sense, and also it will do wonders to our image globally. So that's like one request. The second is, of course, more on the program side. And that is, we are trying to establish this link between sanitation, health, and seeing how it can help impact the financial services sector. So any help, any initiative support from the government would be greatly helpful. Thank
Wonderful.
you.
That's very precise. Well, thank you so much. It was really an honor to host all of you, and I thank you for your time. You all run very busy schedule, and despite of that, you all joined. And our aim, essentially, behind this summit has been that we bring really key thought leaders together, people from technology, from pharma, from medicine, and then from basic, like health, actually together. That's why we see diversity in terms of speakers. And this was an important discussion, and I'm glad that we have some key recommendations from here, and we're going to share this video and the outcome of this conversation with the state governments as well and with other stakeholders as well. I thank you on behalf of the team here, and I hand over back to Surbhi then.
Thank you so much once again. I think what a wonderful conversation. Like we started in the beginning, and our tagline goes, "It's time to reimagine the future, and the time to act is right now." And that's exactly what we've done. And I think the idea behind the entire summit series is just not to keep it on a conversation level. I have to move much ahead of the conversation level and move it to the policy level. And that's the idea when we sum it up, when we sum up the session, the key recommendations have to actually go on a policy level. So thank you so much once again to all our esteemed speakers and panelists for such an insightful discussion. We would love to hear more from you. In fact, I am sure our participants would have more questions. So I would encourage them, if you have anything else to say, you can please write to us. My colleague Shivali will give her email ID. She'll post her email ID on the chat box below. If you need to reach out to us for anything, please feel free to write to us. It would be wonderful to hear from you what you have to say on this series and recommendations for the other series that we would be doing. With that, I think we would now take a short break in terms of not going away. This is, as it is a very short session, but we will do a quick poll. So you would see a screen. There is a poll screen. Shivali will share her screen, and there is going to be a quick poll. There are just very few questions. It will take just 5 minutes. This is open for our participants. Here is the poll, and there are 6 questions. So please start answering them. It's not going to take a lot of time, but it will help us to understand better. The first question is, according to you, what should be the top priority for healthcare in India? How would you rate India's handling of the COVID-19 pandemic? That's the second one. Looking forward for next year, which of these are considered critical or top priorities for your organization? That's the third question for the poll. The fourth one is from our partners. Would you like SAP to connect with you or to discuss how they can help you with establishing spend controls in your organization? And would you, if yes, would you be interested in a free demo? And the last question is for the upcoming summits. Which are the topics you would like us to cover? And that would really help us to actually shape up our upcoming summits. We will wait for another 1 minute for the poll to end and receive all the responses from all our participants. Thank you so much, everyone. And we've ended the poll in here. And with that, again, on behalf of the entire team of Data Leads Health and Analytics Asia and our partners, SAP, I would want to thank all our speakers here. Thank you so much for taking out time in the morning today. We understand, given your your work schedules, it's very difficult to take out time and join us for this conversation. But this conversation was really, really important. I think the takeaways are really, really nice. Thank you so much for joining in to all our speakers from the plenary session. I would now move on to the next session of the day, which is a flash talk session. And I would now hand it over to our resident editor of Health Analytics Asia, Raj, to take it over from here. Sorry, Raj, you're on mute.
Thank you, Survi. I am Vardarajan Ananthakrishnan, and in Flash Talks, we have speakers who share their thoughts in their respective areas of expertise. First up, we have Swati Dometi. Swati is the Assistant VP, Strategic Alliance and Partnerships at Vito, India's first personalized health management ecosystem for people with chronic conditions. Swati will share her thoughts on how technology is shaping medical care. Over to you, Swati.
Thank you, Raj, for the lovely introduction. I hope I'm audible.
Yes, you are.
Perfect. All right. Good morning, everyone. Thank you for having me. It's an honor to be here talking about future of health, digital health solutions in India. As COVID-19 basically struck us in early 2020, I think it all it took us all by surprise. We realized that there are a lot of issues in our healthcare systems. It basically challenged the operational protocols. It disrupted the medical supply chains, created shortages, in our value chain as well. Moreover, I think it introduced or it highlighted the lack of readiness in our ability to fight and overcome such situations. Unfortunately, during this time, I think the population that was most affected was people with comorbidities, and specifically people with diabetes. People with diabetes not just saw complications that resulted in hospitalization, but they also saw a higher mortality rate. There are about over 77 million diabetics in India, of which 80% have uncontrolled diabetes, and an alarming average HbA1c rate of around 8.5. So the need for awareness and self-management increased significantly during this time. Moreover, what we saw was, there were a lot of new cases and new diagnoses that we experienced as well, because people who were working from home were forced to lead a sedentary lifestyle that resulted in this condition. And to make matters worse, people who had just recovered from recovered from COVID, had experienced, higher blood glucose levels in the first 3 months post-recovery. So obviously, all of these conditions accelerated the adoption of virtual care and digital care and transformation, which obviously I think there were more focused on interconnected, personalized solution. And coincidentally, BITO actually stemmed from the same pain point. Co-founders Gautam Chopra and Yash Sehgal, were diagnosed with diabetes in their early 30s about 6 years back. And they discovered there's no optimum solution for them to manage diabetes. Having faced this challenge firsthand, they realized that diabetes management is actually protocol driven, and this can be easily digitized. Of course, they took this a notch further and they made a solution for the entire nation. A little bit on what BITO does. Basically, BITO is a digital health platform that combines real-time monitoring by IoT connected devices and app ecosystem, and to provide AI-driven personalized insights and proactive interventions by doctors and health coaches for chronic disease management, and especially in cases of diabetes. A study that we had done during the pandemic, we realized 55% of our members are first-time blood glucose monitoring users. They bought the blood glucose device for the first time to monitor their blood sugar levels at their homes. And 80% of people who had actually spoken to health coaches in our platform have never spoken to a dietitian or a health coach or a nutritionist in their lifetime. We did not just see increase in terms of revenues and members, but we also saw increase in terms of engagement. We saw there was a significant rise in the number of times a person is monitoring on a platform, and it was around approximately 9 times in a month, which is 3x of that of India's average. Obviously, higher engagement results in better outcomes, and we saw a significant drop in HbA1c of about 15% in 12 months. Of course, as technology advances, interconnected, end-to-end connected, platforms that connects the entire value chain is the future of health sciences and wellness in India. The focus, in my opinion, should lie and will lie in prevention more than treatment, understanding patient behavior to improve health, of course, and need for data predictive models, automation of system, and data-driven interventions. The future of our country, in my opinion, is promising. Of course, we'll have to figure out an effective way to interconnect and interact data and technology together to bring out a solution that is unimaginable and actually, is a solution for the future. And this is what we need to, adapt and abide by. And I just think utilizing health tech platforms for management of patients, creating new treatments, and coming up with new techniques for diagnosis and prognosis is the next future in our country. And that will actually put us decades ahead in the future in just a couple of years?
Thank you, Swati. Thank you for those lovely insights, especially for people with conditions like diabetes. The next speaker is Ashish Bajaj, the marketing head at MediBuddy, India's largest digital health platform. He joins us today to share his thoughts and ideas on how telemedicine has taken shape in India, in policy and in public acceptance. Here's Ashish with his thoughts. Over to you.
Thank you, Raj. Thank you for having me here. I think it's a great start and a great forum that you guys have created. And I was listening to the panel discussion and what Swati also was mentioning since morning. There were a lot of informational area that are very good for policymakers to take a note of and create a accessible and a quality healthcare structure in India. So when I start with a question that WHO has given a doctor-patient ratio of 1:1,000, whereas in India we are at 1:1,500. Now we are almost 50% higher than the global average. Though there is a huge requirement for us to create the distribution for healthcare needs. And I think, like all of us have mentioned earlier before than me, that this can only be achieved when healthcare join hands with technology in terms of distribution. So definitely, it's the what all of us also feel it's the only solution to the problems that we are witnessing right now. And I think pandemic has given us that chance in terms of understanding and one agreeing to the fact that telemedicines can be the solution for future. Because of that, from 2020, the telemedicine guidelines were under construction for 6 years. But since the pandemic hit, government had helped the guidelines to be closed within a month. So there was a huge understanding of the importance of telemedicine also happened at a government end. And globally, if I tell you, since last 2 years, there are 348 new teleconsultation companies, apps, websites, ecosystems have emerged in India. And this is a source from Google. And also because of that, the telemedicine industry has got the eye of India, and it is poised to become a $6 billion category by 2025. So just 4 years down the line, and we'll be looking like a $6 billion opportunity for our own country, which will definitely add to the $1 trillion economy point of view of government. So the shift, I'm sure the shift was not easy. And if I give you an idea how telemedicine has grown in 2 years, for any biggest private hospital in India looks at a footfall of around 10 to 11,000 in a day. We at MediBuddy are helping more than 35,000 patients in a day. So the growth in acceptance of and making it a view of getting as the first entry to the healthcare becoming of telemedicines has seen a lot of prominence and a promise from people around. Now, when we talk about the growth and acceptance of people, it's very important to understand what has happened from pre to during COVID scenario and during the pandemic. We as a brand have seen a 75% growth in our consultations. Overall, the category has seen more than 200% growth in terms of making a consultation online, either through phone or through video calling. It is also important to understand what are the biggest specialities or the departments where people have started accepting the fact of telemedicine. Of course, the number one being the general medicine. Skin and derma is something which people are accepting for. Gynecology, pediatrics, and of late, mental health has become one of the predominant department for teleconsultations in India. Moving on, if I tell you some specific numbers that we look at from UP point of view, the telemedicine growth is is overall at 120%, and this is basis our platform numbers. And of course, Lucknow is leading the adoption. Uttarakhand saw approximately 89% growth, and I'm talking to you about this from last 1 year point of view. So to moving on, I think a digital ecosystem has not only helped teleconsultation, but like how SLR was also mentioning in the panel discussion, that lab tests at home have also increased because of the availability, because of a better distribution. And when we talk about the better distribution, there has been a hockey stick growth in lab tests at home, and people accepting the fact that I don't have to travel to a diagnostic center, and a technician and a right kind of a person with the knowledge can come in my home and do those healthcare checks for me. So basically moving more towards a preventive healthcare. And we've been seeing in last 2 years, tier 2 and tier 3 cities and have been adding almost 44% growth in lab test at home category. If I specifically tell you how we saw on our platform, Lucknow growing at an astonishing 77% growth in last 5 months itself. Whereas Dehradun has seen 34% growth in last 5 months. So all in all, if I have to, if I sum it in quick, I think definitely for all of us as a 1 billion nation and to cover the Bharat, telemedicine is the answer. There are government initiatives which are helping in adoption, and also the private players who are increasing the visibility and distribution of quality healthcare. Whereas we are also playing our role in terms of bringing it to the users. And if I tell you, I give you an example, an instance, there's a very small town in Orissa who has never done a online payment or a wallet payment. Koshi, that has accepted the fact, and one of our customer did a teleconsultation in that market. And so basically, yes, the adaptation is there. People into the nook and corners of India will definitely get a hands-on or a good quality care reaching to all of them. Thank you, Raj.
Thank you, Ashish, for sharing your thoughts. Telemedicine is indeed getting bigger in India, and that can be only good for the country. The next speaker is Professor Farzana Mehdi. She is the Vice Chancellor of ERA University in Lucknow. She is here to share with us how medical education has evolved in India and about ERA's role in pandemic management. Over to Professor Mehdi.
Good morning. Greetings from ERA University, Lucknow. It gives me immense pleasure to be part of this E-Summit, Health of India, especially for Uttar Pradesh and Uttarakhand. Over the years, medical education in India has evolved from following a traditional curriculum to following competency-based medical education. In the year 2019, National Medical Council, NMC, introduced this curriculum, which is competency-based. It speaks about producing an Indian medical graduate who has the following roles: the role of a clinician, a good communicator, being a good leader, lifelong learner, and a professional. In order to achieve this, the faculty across India has been trained to deliver this curriculum to the medical graduates. Although in the same year when the curriculum was introduced, we saw the beginning of the pandemic. With the advent of the pandemic, the teaching, training was disrupted. State of Uttar Pradesh had only 7 medical colleges and 2 central medical colleges. But over the last few years, we have seen a number of new medical colleges have been started by the Uttar Pradesh government. And recently, in the month of October, 7 more new medical colleges have come up at various district levels. With these new medical colleges, the healthcare facilities have been brought to the doorstep at the grassroots level. This will not only produce doctors, but also deliver health facilities. In the year 2019, the entire world saw the beginning of pandemic, and everyone is aware how this pandemic affected each and every one of us. The medical services of the most developed countries like US, France, Italy, they virtually collapsed with so many patients to handle, with not knowing anything about what COVID was, how it's transmitted, how you can treat it, how you can prevent yourself from getting it. In India, we saw in the month of March 2020, the lockdown started. And with the lockdown, all the services were disrupted. The teaching, training of all the students, not only medical, but all the students was disrupted. We had to move to the online mode, which we, with the help of the faculty members, we devised the online teaching program, and we managed to deliver whatever best we could under the given circumstances. ERA Hospital, being 900 bedded hospital, was given the status of dedicated COVID hospital with L3 facilities. Being faced with such a big challenge, in March 2020, when the lockdown began in India, we saw the disruption of all the services, be it teaching, training, any other activity. Being a medical college, we started our online teaching training. With the help of the faculty members, we tried to deliver whatever best we could. Since we were also running a 900 bedded hospital, we were given this responsibility of treating COVID-19 patients in our hospital. The government allotted ERA as a dedicated COVID facility, L3 facility for the treatment of the COVID-19 patients. In the beginning, as you all know, the faculty, the young doctors, the nurses, paramedical staff, everybody was very apprehensive. But as you know, in every situation which gives you a challenge, it also gives you an opportunity to rediscover yourself and align yourself to face the new challenges. ERA did the same, as all the health professionals came together as a team, and all of us tried to work day in and out for treatment of the patients. And with our dedicated team and dedicated doctors, we were able to save lives of hundreds of patients which were admitted with ERA. ERA has been recognized at numerous fronts for giving these excellent services for the treatment, and a lot of awards and recognitions have come our way. With the advent of the COVID, what we have learned, that having a dedicated team, a well-trained team, and working in liaison with other government hospitals, all coming together as we had come together by having an integrated system of referral. It was due to this referral center which was working, the availability of the beds in the hospitals, the patients' lives could be saved, as they knew where to go, where they will find a bed for their treatment. The government tried to help all the institutions who were giving the treatment of the COVID-19 patients, and not only helping us with the machines required for the ICU and other equipments to the hospitals. Now what has happened that over this period, few lessons learned from the COVID are that now all the hospitals are well equipped, not only with the infrastructure, machinery, but well trained ICU staff, be it the doctors, the nurses or the paramedics. Before this, the ICUs in the hospitals were having very few beds. But with the advent of pandemic, the number of beds were increased, sometimes to the capacity of 3 to 4 times. The shortage of oxygen faced by us during the second wave has also taught us a lesson. All the hospitals in Uttar Pradesh are now well equipped with oxygen plants, and they are trying to produce their own oxygens so that in future, if at all such a time comes, we will not have to face the same crisis. So having dedicated teams for the ICUs, not only the ICUs but ICUs for the children, which are called PICUs and NICUs, we have built. These are the lessons which have not only taught us but also have increased our strength in those areas, especially where we were not well equipped. So now the second wave is over. What we have seen, a number of patients coming with the long COVID problems. So we are in the process of treating and trying to manage all the other ailments related to the COVID-19. To sum up, the future of medical education and healthcare services in Uttar Pradesh have seen a dynamic change, and the lessons learned during the pandemic have taught us how to face challenges, how to work as a team to face any medical emergencies which we can have in future. Thank you very much.
It's been more than a year since the COVID-19 outbreak.
Thank you all for your valuable insights and thoughts. That concludes the Flash Talks for this edition. I now hand over back to my colleague, Surbhi Pandit Nangia. Over to you, Surbhi.
Thank you so much, Raj, and thank you so much to all our speakers of the Flash Talk session. Thank you, Swati. Thank you, Ashish. And thank you so much, Professor Farzana, for sharing your thoughts. I think together, the idea, like we said earlier, is together we can fight this and make healthcare our priority in the time to come, and not actually face the same problems that we faced in the healthcare during the pandemic. So thank you once again for joining us today for this session, the Health of India series, specifically for Uttar Pradesh and Uttarakhand. We will continue the conversations as we have done that in the past with the other states to follow. We will keep you all updated, and please keep joining us, writing to us with your recommendations or anything that you have to say. If you still have any questions, you can please feel free to write to us. Shivali has already shared her email ID with you. I think it will be wonderful to hear what you have to say. With that, thank you so much. It's very, very important that you stay safe, keep wearing your mask, and not let your guards down. I think it's very important. COVID isn't over yet. And let's all ensure that we stay safe to the time it's completely over. With that, thank you so much. I would end by thanking our partners, SAP, for making this summit and the series possible. And thank you to all our eminent speakers who've taken out time to be here with us and share their thoughts. And a big, big thanks to all our participants for being there present today and sharing your thoughts and sharing the question answers, the questions with us today. And of course, when I end, I always thank the team that has made that possible, the team with Data Leads and Health Analytics Asia, who's made this possible. Thank you so much once again. Please take care and stay safe.